Good morning. My name is Michelle Lavander, and I'm the director of the USC Center for Health Journalism. Thanks for joining us today for our Covering Coronavirus webinar, What Anti-Asian Hate Means for Mental Health, Safety, and Justice. Recently, I've been following the Stop AAPI Hate hashtag, which we invite you to use to tweet about this webinar today. I came across a tweet from Riverside Press Enterprise reporter Allison Escobar. For many Asian Americans and immigrant families, mental health is swept under the rug, she wrote. With the attacks and fears on this community, more people are realizing that mental health matters. Another missive that popped up on my screen from Heavenly Hokulani, after the Hawaiian word meaning star in heaven. In response to hate crimes against Asian American Pacific Islander communities, I organized a virtual event. Poets, singers, artists, activists, and more are coming together to kick off AAPI Heritage Month and raise awareness and funds to stop AAPI hate. The two tweets capture the range of responses to a wave of attacks against Asian Americans and Pacific Islanders that have overtaken daily life for many from these communities and that we will be discussing today. These days, many Asian Americans report feeling frightened and weary, angry and stressed, but they're also moving decisively, developing self-help strategies, including bystander intervention trainings and new volunteer organizations such as LA versus Hate, a Southern California network of 100 local organizations that provide victims of hate with mental health, legal, and other support. The Pew Research Center recently reported that 32% of Asian adults say they have feared someone might threaten or physically attack them, a greater share than any other racial or ethnic group. 81% of Asian adults also say that violence against them is increasing, far surpassing the share of all US adults. That data mirrors similar findings just in the last 2 months, where more and more reports of racist incidents are pouring in to stop AAPI hate. One reason for the jump in reports, according to founder Russell Jung, who we'll hear from today, might be that Asian Americans are less willing to remain silent than in the past in the face of hostility and even physical violence against them. Today, we'll explore the responses to this wave of hostility and the impact of this crisis on the mental health of Asian Americans, especially the women who are often targeted. We'll explore how providers are working to help, especially in communities that were already at high risk. And we'll ask ourselves how the media can play a constructive role, covering sometimes overlooked issues with sensitivity and nuance. We'll be hearing from three distinguished speakers: Ann Doe, a Los Angeles Times reporter covering Asian American issues, a second-generation journalist. She's also worked at the Dallas Morning News, the Seattle Times, the Orange County Register, and Nok Viet Daily News, the largest Vietnamese language newspaper in the United States, which was founded by her late father. Born in Saigon, she's reported from Cuba, India, Mexico, Peru, and Vietnam. Her writing on race and culture has won many awards, and she's a member of our center's advisory board. We'll also hear from Russell Jung, a professor of Asian American Studies at San Francisco State University. In 2020, he launched Stop AAPI Hate, which tracks COVID-19 related discrimination in order to develop community resources and policy interventions to fight racism. The project has become a go-to resource for journalists and others seeking to understand the surge in anti-Asian attacks. Professor Jung's research interests include the sociology of race, the sociology of religion, and social movements. He is the author of 5 books. And we'll also hear from Linda Yoon, a therapist and founder of the Yellow Chair Collective, a multicultural psychotherapy practice with a special focus on Asian mental health. Yellow Chair Collective strives to fulfill the needs of people of color and immigrants by providing culturally competent services. In addition to therapy, the practice also provides psychoeducational groups and training on the impact of cultural and racial trauma. Yoon is a graduate of the USC Master of Social Work program. This webinar is made possible by the generous support of the Commonwealth Fund, the National Institute for Healthcare Management Foundation, and the California Endowment, as well as individual supporters like you. You can tweet about this webinar at the hashtag #StopAAPIHate. And now we're going to turn to Professor Russell Jung to tell us a little bit about what he's finding through Stop AAPI Hate.
Thank you, Michelle, and thank you, Center for Health Journalism, for hosting this webinar. We're grateful to be here and for this opportunity to share. So last year, when COVID-19 was coming from China, I, as an Asian American studies scholar, was really concerned. And I knew from the past that Asian Americans would be blamed for the disease and then be met with interpersonal violence and racist policies. So we created Stop API Hate website tracker to collect individual reports of what was happening. We noticed in news accounts that Asian American businesses were being avoided, that people were being shunned, but we wanted to document the issue to figure out what was happening, to track trends, and to provide policy interventions. And what we heard was horrifying. And the hate and anger directed towards Asians was appalling. We were getting over 100 incidents a day, and that surge has continued. So I'm going to share with you now some of the data that we've received, some of the impacts of the racism that Asian Americans are experiencing now. So as of the end of February, we received 3,800 incidents, but this was before the Atlanta shootings, and we got a lot more attention. And since then, we've actually doubled the number, and we're coming up with a national report next week. So please stay tuned. Some of these percentages have shifted a bit, but overall, the types of racism we're experiencing have remained the same. There's four main categories. Not everything's a hate crime. The first category you could see is civil rights violations. This made up about 8% of our cases, being mistreated at the workplace, being barred from ride shares. So if an Asian would cough in the office, they would be sent home, whereas if a white worker coughed, they would be allowed to stay, would be an example. Online harassment would make up 7%. This particularly impacts our youth, who report a lot more online harassment. They get cyberbullied, they see racist posts and memes. Microaggressions make up the largest. 68% is verbal harassment, and 20% is avoidance or shunning. So we talk about being coughing while Asian. If you cough, people would move away from you subconsciously, even perhaps. You don't necessarily know if it's because you're Asian that people would avoid you. It could be other reasons, but Asians notice that people have acted differently among them. So here's a key takeaway point. The verbal harassment, I don't think is necessarily that micro. There's trauma with a big T and trauma with a little t. Microaggressions are small t's, but they add up and they have the same impact as big trauma, such as war or poverty. These microaggressions add up, and they're horrifying because people are often gang bullying on Asians. They're using epithets, they're using slurs. Oftentimes, it's gang bullying. So a key point is that 1 out of 5 Stop AAPI respondents, we've conducted a study afterwards, after they reported, 1 out of 5 now report signs of racial trauma. This is elevated symptoms of anxiety, depression, hypervigilance, and avoidance of places. So this avoidance and hypervigilance are the hallmarks of trauma. So clearly what's happening has deeply impacted Asian Americans' mental health. Physical assault makes the fourth major category. We're getting coughed and spat upon so much that we created a special check off so that people, yeah, I was spat upon. Nationwide, and a white cashier in New England was coughed upon, and that person was arrested for terrorism because it's clearly a public health threat. You could argue that Asian Americans are facing mass terrorism because we're getting coughed on and spat upon so often. My own wife was running and someone blocked her path and just coughed in her face. Physical assault makes up 11% of the cases. These are the hate crimes that you often see more in the news if racial bias is discerned. And that's the issue is, does every crime constitute a hate crime? But overall, Asian Americans have been pushed and shoved so much. I've seen so much attacks of having bottles and rocks thrown at our elderly, that I just thought it was a matter of time last year that we would see elderly who've been killed, and that's what's happened. Sadly, we sort of expected something like the Atlanta shootings because, again, we saw so much anger, hate, and fear directed towards Asian Americans and so many attempted assaults. So this has continued this year, possibly because Stop API Hate is getting more attention. Also, now that we predicted last year that as we come out of the pandemic, Asians are now interacting with the public more. And as we go out and as more people are working and taking public transit, we are actually increasing the attack, the opportunities for attack. We see clear, consistent patterns throughout since last March that vulnerable populations are attacked. Women are attacked twice as much as men. Girls are attacked, in fact, twice as much as boys. Youth and elderly are disproportionately represented. Again, you don't think of Asian American seniors going and complaining about racism, but they are, because they do know when they're being mistreated. They write to us that they don't necessarily want individual redress. They just want to help develop a collective voice to make it stop so it didn't happen to their family members. This is also a clear case of racial profiling. 60% of our respondents are not necessarily Chinese. Most are East Asians who look Chinese and people mistake them for being Chinese. So it's Vietnamese, Koreans, Japanese. In fact, a Latino woman was punched and shoved and told to go back to China. An Indigenous person in Vancouver was punched and shoved and told to go back to China. So this, for me, really harkens to the yellow peril stereotype. And for me, this is the operative stereotype, the primary source of racism. It's that Asian Americans are seen as outside threats, as the peril, that we're outside threats that are invading the West with our diseases. This peril has been invoked throughout Asian American history with the Chinese Exclusion Act and the diseases of cholera, smallpox, and leprosy. It was evoked again with the disease of the bubonic plague, later with tuberculosis, and then SARS. Time and time again, when diseases come from Asia, Asians are perceived as the source of the disease, and then policies seek to exclude them, and Asian Americans meet interpersonal violence. So more than the model minority stereotype, you hear a lot from Asian Americans about the model minority stereotype that we're achieving and hardworking, and that masks the inequality that Asian Americans face. But I think this yellow peril stereotype is much more operative. Just for quick context, Asian Americans are racialized differently than Blacks are. We're racialized whether we're considered inside to America or outside to America, whether we really belong and are considered to be Americans, or we're considered to be not fitting in, unacceptable. Sometimes when we're on the inside, we're model minorities, we're white adjacent, we're crazy rich Asians. But in times of war, such as Japanese American incarceration, World War II, or what happened to South Asians, Muslims, and Arab Americans with Islamophobia after 9/11, in times of economic downturn and in times of pandemic, Asians are framed more as perpetual foreigners who are outsiders who don't belong. Last year, we had all three conditions such that they combine to really frame Asian Americans as disease-carrying threats. And that's why we're told time and time again, in 40% of our cases, go back to China, you effing. 40% of our incidents have racial slurs or anti-immigrant sentiments. This portrayal of outsiders as perpetual foreigners to the nation or to a neighborhood is probably why Asians get objectified and treated so subhumanly, or I don't know, people have license, it seems like, to push and shove us, to spit on us, to attack our elderly. And I think it's only because they were perceived as outsiders. It's this us, them, inside, outsider stereotyping that's really impacting us at the moment. I have a slide on the mental health, but the impacts of this racism has been really deadly for the Asian American community. And for Asian Americans, we're the racial with the highest mental health distress during the pandemic. And those who face racism have even higher rates of depression and anxiety. And I'm sorry, I don't have that slide now. But here's another takeaway point. Again, we surveyed our respondents and we asked those who experience racism, what's your greatest stressor during the pandemic? What's your greatest fear? And overwhelmingly, unanimously, they named racism as their top fear during the pandemic. So think about this. Asian Americans are concerned about other Americans' hate than they are a pandemic that's killed over 500,000 people. Asian Americans are more fearful of other Americans. We're more concerned about other Americans than a pandemic that's killed 500,000 people. That's how widespread the racism is. That's how insidious it is. That's how traumatizing it is. That's how deadly it is. We can cover ourselves with a mask to protect ourselves from COVID-19, but we can't protect ourselves from some random stranger coming up to push us or attack our grandparents. And that's why Asian Americans are in a state of siege. I think the community is really fearful and anxious now. To quickly wrap up, racism has also impacted our ethnic economies. People were avoiding Asian businesses for fear of the disease. And as a result, those businesses had to close, and our working class and service sectors have been really impacted. We're the racial group with the second highest rate of joblessness in the country right now after African Americans. And clearly the racism has impacted us. It has become institutionalized. Last year, the administration extended the Muslim ban to include Asian countries. The administration suspended visas to Chinese scientists and researchers, cut migration visas so families couldn't reunite, cut refugee resettlement, cut H-1B visas. So all these policies basically excluded Asian agains because we're seen as outside threats, either national security threats or health threats. So we've seen history repeat itself, and sadly, the community is up in arms at the moment, and I could talk later about how we're responding, but thanks for this quick opportunity to share.
Thank you so much, Russell, for this overview. We're going to turn now to Linda Yoon, who is going to talk to us about some of the mental health impacts of all this.
Hi, everyone. So we'll start the slide. So I'm going to be talking about the rise of anti-Asian racism and its effects on mental health. First, let me introduce myself. My name is Linda Yoon. I'm the founder and co-director of Yellow Chair Collective. Yellow Chair Collective is a multicultural psychotherapy group with a special focus on Asian mental health. I'm also a licensed clinical social worker, therapist, 1.5 generation Korean American immigrant, which means I have immigrated to the United States before the age of 18 as a child. Here's some data about Asian American and mental health. So Asian Americans are the fastest growing population in the United States at this time. Between 2000 and 2018, the Asian population grew 81%, and it is projected to pass 35 million Asian Americans by 2060. And it is also a least likely group to receive mental health services. Serious mental illness rose from 2.9% to 5.6%, ages between 18 to 25 in 10-year period. But 8.6% seek out mental health services compared to 18% of general US population. I do want to note that that is a little bit older data. We do not currently have a current data yet. And data done by 2020 mentioned that a lot of Asian Americans were expressing their mental distress over both pandemic and the rise of crimes, hate crimes against them. And Pew Research Center actually released some surveys done in 2021, last month, I believe. It stated 1/3 of Asian Americans report that they fear threats and physical attacks due to the recent surge of hate crimes. So here are some emotional impacts that a lot of my clients are sharing. We have a lot of individual therapy, family therapy, team therapy, but also we have Asian support groups going on right now that was respond to the surge of the need of mental health crisis that Asian Americans were experiencing. Currently, we have 6 cohort going up and we still have a waiting list. So you can tell how much need there is right now. So common things that are being shared, not feeling safe in public. Some of them are mentioning that they're even considering covering their faces, so they can hide their identity being Asian. Feeling invisible to their friends, family, workplace. A lot of them reported that they felt like people who they care about, the communities they are part of, are not doing enough to acknowledge what's happening. And a lot of them share creating the safety plan in case of racism attack happening to them, their family, their child, even their elderly members. And there's a lot of trauma reactions, very similar to PTSD symptoms. However, what makes racial trauma very unique is when PTSD is post-traumatic stress disorder, a lot of racial trauma is not post. There is no ending to it right now. It's past, present, and ongoing. So it makes it very unique and tricky trauma symptoms to treat sometimes. And for older generation Southeast Asians, including Vietnamese, Cambodians, Laos refugees, immigrant population, the recent violent crimes actually really triggered their PTSD symptom that reminded them of war, genocide, displacement they experienced in their home country. A lot of physical symptoms that is included in trauma, sleeplessness, nightmares, flashback, dissociation, and a lot of people are also reporting confusion, a lot of loneliness, and a lot of anxiety and depression, and a lot of anger towards injustice that's happening. So here are some data that we collected. This year, January to April, our calls have doubled compared to last year. And right now, about 80% of our clients are Asian Americans. And just Asian American alone, the number doubled. And 64% of the inquiries this year mentioned racial trauma and recent anti-Asian attacks as their stressor for making the contact. And 50% inquiries were actually first-time therapy seekers. So that's a really significant increase, especially knowing that Asian group has been very least likely group to seek out mental health services. And from total number of Asian American clients at YCC right now, 96% of clients reported that recent anti-Asian crime surge has impacted their mental health. So I want to talk a little bit about challenges for Asian Americans to access mental health services. And this is more especially applicable to first generation immigrants and older generations. I said that because a lot of younger generation and second, third generation who have acculturated to United States Western culture, they have more understanding of what mental health is. So in generally speaking, there's a lot of lack of understanding of mental health services, what that is, and a lot of cultural stigma against it too. However, I want to unpack that lack of understanding of mental health services and cultural stigma by kind of comparing the Western approach and Eastern approach. So concept of mental health comes from psychology, which comes from the Western culture and study. And psychology kind of separates mind from the physical health body. And it's not existing in the traditional Eastern society wellness. And it makes sense because it doesn't exist in Eastern wellness and society traditionally, why it is hard for a lot of Asians to understand what mental health is and have stigma against it. In traditional Eastern medicine and wellness, they talk about yin and yang, balance, which also include balance of your body and mind. And there is no separation between body and mind. So a lot of times, Asian Americans will complain their mental health symptoms in their physical somatic sense. So we talk about pain in our body. We talk about anger that lives inside our body. We talk about the shoulder pain that was caused by family stress. We talk about stomach issues that has been impacted by stress and anxiety. So a lot of medical doctors will be the first one to hear about their mental health needs. And to reduce the stress and stigma and increase the understanding of mental health services, we will need to support and create more integrative, holistic approaches in mental health that will make more sense to Asian population. And my fourth bullet point, not enough culturally competent and linguistically competent services. So this means a lot of providers do not understand their cultures and they do not speak the language, their native language. And recent survey done by Southeast Asia Resource Center in 2021, they found 29% of the survey participants stated that lack of language service was issues to accessibility. If they cannot speak their language and express their feelings and emotions, what's happening to them, how can they, receive the services they need, right? And there's lack of research funding for Asian mental health programs. And there needs to be more collective approach to trauma because a lot of traumas that Asian Americans are experiencing is collective. And there need to be more outreach to the community to increase that collective movement. So these are some interview tips from a therapist. So if you are planning to do some interviews, I will say first, kind of recognize if there's any biases you might have against Asian community. And be mindful the use of Asian American, Pacific Islander, Southeast Asians, AAPI, APDA, which is Asian Pacific Islander, Desi American. They are not interchangeable. They do mean different things. And sometimes Pacific Islanders some Pacific Islanders do not identify themselves as Asians. Please note that Asian racism has a long history. Yes, recent search made it more visible. However, there always been anti-Asian sentiments that been in the history. Understand the model minority rhetoric and its impact on Asian American community. Try to be accurate in reporting interviewees' ethnicity, cultural background, and maybe their names. I know after Atlanta shooting, there was a little bit of controversy around reporters not reporting the full names of the Korean victims. Try to be accurate in data. Try to use data. However, please note that a lot of Asians, even though there has been increase of reporting, I personally have been hearing in my therapy sessions and support groups that even they experience this hate crime, they do not want to report because there's a lot of shame, language barrier, and cultural barrier. So it is in the culture, it is historically underreported. So please be aware of that. And realize one person's perspective may not represent the whole community's perspective, so please avoid generalizing and assuming. And tell stories, explore intersectionality of the person's struggle with the recent hate and violent crimes. So there's a lot of tips, but if I ask to remember one thing, I will say, the last bullet point, please tell stories. If you are really listening, really hearing, then you will really understand and really able to follow all other interview tips, naturally.
Thank you so much, Linda. We're going to turn now to Ann Doe, a reporter covering Asian American issues at the Los Angeles Times.
Hi, everyone. Thank you so much for joining us today. And let me start by thanking the organizers for caring about what's happening in Asian America to host this gathering. I also want to share my appreciation for Russell and Linda for their precise talking points. Please let me add a third thank you and say how grateful I am to you, our audience, for joining us during this hour. At the start of the pandemic, I was working from home, but within 3 months went back to the streets because really I wanted to have a better chance to absorb coronavirus life with its daily quirks, challenges, demands, its beauty, as well as its tragedy. When it comes to the mental health of communities, this is what I've heard during face-to-face interviews. Many people do not want to shoulder the fear burden anymore. At the start, they bent to cultural tradition. Lots of Asians and Asian Americans kept quiet. They were taught to keep their troubles to themselves, and they wanted to avoid attention to their families. But as the attacks and violence that you've witnessed, that we've all witnessed, swirled and climbed around us, they changed gears. Like Linda and Russell cited in their data and in their anecdotes, you know, they started reporting crimes and incidents and creating safety plans for their loved ones. They gave their children mace. A tutor that I interviewed as he stood in line at a barbecue restaurant to buy roast pork in Little Saigon mentioned that quote, "It's ridiculous that my sister, my aunt, my grandmother can't experience security in their own city. No one feels like they can just run outside at any time." This man then turned to a worker at the takeout joint and asked him whether he felt safe in light of seeing increasing racially motivated attacks. The man shrugged in response and then confided that his daughters had bought him a bulk supply of pepper spray. Quote, "Even people in the ethnic enclaves are preparing," the tutor that I mentioned earlier added, and he was alluding to neighborhoods that included Chinatown, Koreatown, Thai Town, and Little Saigon. He himself makes sure that his phone battery is always charged, ready to be used in case, quote, "something happens and I need to record it. Videos will be our proof." On another assignment, I was near the entrance of Peking Kitchen along Santa Ana's bustling 17th Street. And I met two 20-something women who said that they depend on comfort food, given what's happening increasingly in SoCal and around the nation. Last month, they told me that, quote, "We're interested in news about vaccines, you know, how to get it, but all we hear about is violence." One of them really worries what would result if struggling stores in these ethnic enclaves become targets more and more. She's also scared for the mental health of immigrant families, quote, "just trying to live their lives and stay safe. They need public support for their right to live harassment free. And many of them are just going on doing honest work." When these two women from Santa Ana leave home, they are never alone. They make sure to have someone accompany them, even on the smallest errand. That's the buddy system that we see countless Asian Americans employing. In this environment, one of the women who is half Chinese said, "You need that buddy, someone extra to be a witness in case something goes wrong." When I went to the Bay Area twice earlier this year to report on escalating threats, on the streets of Oakland, I shadowed volunteer foot patrols, and many of them had never, ever gotten involved in grassroots activities before, but they couldn't sit alone anymore. They said they rushed from their like truck driving jobs or their manual labor jobs straight to places like San Francisco, San Jose, and Oakland, and work Friday nights, Saturdays, and or Sundays, offering their services as chaperones. And you know, a lot of the elderly men who are Asian told me, You know, we don't use those services because they're for the women, they're for the more helpless gender. But absolutely, they would urge like their wives, their mothers, their sisters, their female friends and coworkers to use these services. And in the beginning, there was a huge reluctance. But later on, we saw that you could be anywhere in the city of Oakland and just call an 800 number. And within 10 to 15 minutes, they would send a volunteer to accompany you or to accompany the small business owner, say in Chinatown, to the bus stop or back to his or her home. You know, a lot of people have asked me, what is it like to cover this issue of the moment, working for the largest media organization in the state and the largest population of Asian Americans statewide across the nation, and also a media outlet that is owned by an Asian who has been very vocal about discrimination that he experienced initially under South Africa's apartheid system. You know, I just try to take it day by day. I have my own safety plan in case of being attacked, and I would suggest that many of us do the same. You know, we've equipped also our friends and family, but my concern is more about how to encourage people to talk to us and to share the trauma so that we could, as Linda said, tell stories at the intersection of different dimensions. People are very reluctant, but I feel like I use all the patience that I have. And I also try really hard to explain the reporting process to the sources. Like, you know, we're not just interviewing you, we're interviewing 10 people for this story. And, you know, we may not have enough space to use all 10 experiences, but we're going to extract the diversity of all of your experiences and publish them. And here's how it will appear on our pages or on our website, and how we work with our editors to try to represent larger attacks as well as more subtle attacks. And we're also looking for a wide swath of Asian America, you know, not just the more visible Asians who are Chinese, Japanese, Korean descent, but we would love to hear from Cambodians, Laotians, the smaller groups. And if you have any advice for us, we're game to listen. We don't have all the answers, but we are really trying to be out there trying. I feel that the LA Times coverage pre-Atlanta was sporadic, my own coverage included, but post-Atlanta, we have more of a game plan. We've had virtual meetings with all different representatives from multiple departments at the paper. And, you know, with just that mix of creativity, energy, and liveliness, I think that we've been able to expand our coverage. And it's not just being done by Asian Americans, but by all kinds of staffers with different ethnic backgrounds. And we're very, very grateful for that. I really thank you for following our coverage day to day. And please feel free to reach out to us if we're missing something, if we have our blind spots on, you know, our DMs, our emails, everything is open. You know, we want constructive feedback. We're not defensive, and we're trying our best to be open-minded. If you see something that we're missing, call us out. And thank you very much for your attention today.
Thank you so much, Anne, and thank you for all of our panelists. I just want to remind everybody that you can post your questions in the Q&A in Zoom. It's at the bottom of your Zoom panel. And while we wait for folks to enter a few questions, I wanted to start out with a question for all three of you, which is, you're really immersed in these issues every day, all day, but really in with multiple identities as a person, an Asian American person, and as somebody who's professionally dealing with all this. And I'm just wondering, how do you manage that kind of mental health strain of having this be something that doesn't really turn off for you?
I eat a lot. Yes. And I'm allowing myself to eat whatever I damn well like. So, you know, food is comforting, and also it's really inspirational too. And I think we exercise, we have a highly energetic dog and gets us out all the time.
For me, it's been a really difficult time. I feel like, because we read hate incidents on a regular basis, and we have thousands of them now. And then to see elderly push and shove really cuts close to home, right? My own 94-year-old mom, she used to roam around San Francisco so much, and then now she's really restricted, and it's sad. And so I'm both angry and I'm sad and distressed about the state of America. And then, so I think a lot about racial trauma, what Linda was sharing about what does healing look like? And for me, it's still a live question about, we could become resilient, but can we really be healed? And the second question then is, how do we not perpetuate the violence? And I'm afraid that hurt people hurt others, abuse people abuse others. As Asians face racism, we can then become racist towards others. We become anti-white, anti-Black. And how do I stop that within my own self? And how do I stop that for my students? And what prescriptions we have for our society so that we actually stop that cycle of violence and racism? So it's a real live issue for me. And just, I guess, one quick thing that I talk a lot about is that I am heartened to see Asian Americans standing up. And that does give me some encouragement and heartens me to see our community really mobilized and working in unity with other allies.
Yes, and just to quickly build on what Russell said, I think for all the stress that we may go through, it's nothing compared to what the victims of attacks are enduring. And I feel just this huge awe at their courage. The grandmother who took out her cane and fought back and then donated the hundreds of thousands of dollars that she raised in her GoFundMe, to social services causes. And another thing is, Stop AAPI Hate and similar organizations are compiling this data, which is so valuable for us. And it's prompting more people to come forward. In the beginning, we had a lot of challenges convincing people to go on the record. And now I'm getting emails from ordinary folks saying, I want to talk about what I endured.
Linda, do you want to add to this? We also have some questions, but I wanted to give you a chance to reply.
No, I do want to just add on like how I take care of myself and maybe some tips. I do love to eat too, so eating helps. I do go on walks, taking dog out and spending time with people, doing meaningful activity that really helps you feel grounded and centered and reminds of who you are. And going back to your cultural roots, like what makes you proud, what are the strengths and positive about your culture, and also getting together with other people who also share the experiences and also want to do more. I mean, going to rallies, engage in civic events or activism really do help to feel that empowerment, so you don't stay in that helplessness feeling.
Thank you. We have a question from Corinne Chin, who says, do the panelists have advice on addressing collective trauma, both psychological and in terms of solutions-based coverage ideas?
Hi, Corinne. Thank you for your question. I think this is really important and we need to do more of it. I would like to see more video coverage of things that are working, people who are coming forward and having dialogues with their neighbors or with their perpetrators potentially, and what they learned from it. The Orange County Human Relations Commission, which has worked for hate crimes, to help people understand and publicize them, to educate society. They have held a lot of living room dialogues in the last 10 years, which has brought all kinds of mindsets together and really helped to peel back the layers. Another area that I think is important that we often overlook in our coverage is that anti-Asian racism is not new. The pandemic has really lifted the lid on it, but as Linda and Russell both cited, this has existed for decades. And it would be nice to see historical context.
Yeah, thanks, Alan, for those suggestions. We are actually coming up with more of the historical context to put on our resources. Again, we're working on a whole history of the yellow dusky peril, which I think is one of the primary roots of the racism. Again, that fear of Asians as outsiders, and since we don't belong, we could be treated racistly. We are coming up with a report on promising practices. So Michelle mentioned LA versus hate. It is a great neighborhood-based arts intervention. Other community-based interventions include community ambassador programs, right, in San Francisco, Oakland, where we have citizens, rather than we having more policing and more patrolling, we just have people welcoming people to a neighborhood, right? And that creates a sense of safety. So we are promoting these types of promising practices to address racism. For collective trauma, now that we have more capacity to stop API hate, we know that mental health resources was one of their top requests, that and legal information. And so we're going to try to provide more mental health resources. We're working with the Asian American Psychological Association to put those out. We're working with other groups to actually make it more accessible, right? And maybe not just in written form, but in video form, in multiple languages. Make sure, again, like Linda talked about, they're culturally responsive. So one idea that we're going to try to implement is, like, how do we talk to our elders about the trauma, right? And I realized our elders have already gone through trauma. They know what it's like to go through poverty, war, migration, right? They probably have better lessons for us than what the younger generation has to teach them. So we're going to interview elders with their spiritual and cultural wealth to share. And we figure other elders will listen to other elders better than, younger generations talking to them. And then the younger generation could also learn from these wise elders. So that's another project we're going to do, is our Intergenerational Stories project. So those are ways I think we're trying to deal with the mental health issues on a collective level and the collective trauma.
Thank you so much.
I do want
Oh, go ahead.
really quickly. Southeast Resource Center actually has a great model to address collective trauma, which integrates spiritual, cultural coming together, getting involved, along with doing some group and individual work. It has to be very integrative and holistic when it comes to collective trauma.
Thank you, Linda. We have a question from Anna Almendrala. She wonders, what have we learned from the experiences from the South Asian, Arab, and Muslim or Muslim-appearing communities after 9/11? Can the AAPI, East Asian, and Southeast Asian communities get a sense of where this is all headed based on what happened after 9/11?
Yeah, I'd love to answer that question. So that's a great question. And in fact, Manju Kulkarni, one of the co-founders of Stop the API Hate, and Artie Kohli, who's the leader of the National Table, another coalition, are both South Asians who've learned from the 9/11 experience. And so we're really building on the wisdom of Black Lives Matter activists activists from the Justice for Vincent Chin campaign in the 1980s, and from those who've had to deal with Islamophobia. Early on last year, we actually had a planning session with a lot of these South Asian activists to prepare for events such as a mass shooting, such as racial profiling, such as mass deportation. And actually, all those planning sessions, they became realized. They became institutionalized policies or incidents against the Asian American community. So we were able to actually be somewhat prepared. You're never really prepared for a mass shooting or for a or government detention of people, but I'm actually really, again, what helps me go is, or keeps me strengthened, is learning from the wisdom of others and having that solidarity. So I think we've learned a lot from those who worked through Islamophobia. We're working with South Asian Americans leading together, a lot of the other people who've done reporting. And so learning from the experience of others has been really helpful at this moment.
So we have a number of questions from people asking some version of how can others be supportive and be allies. And one in particular from Anjana Najarajan Bhutani says, what advice do you have for South Asians to show solidarity with the other Asian communities that are being persecuted right now to stop this cycle? But we also have, just in general, a number of other people asking that question.
Just personal level, probably. We hear a lot from our clients is that they feel like people are not checking on them. So checking each other. Do not contact someone who you did not talk for 10 years per se, but someone you know in the workplace, you have contacts here and there. Just check in, and that can mean a lot. And also there's bystander trainings, what to do in terms. So when you witness that kind of crimes in public.
Yeah. Last week, I participated in a conversation about race among journalists of color, where we had representatives from the Asian American Journalists, National Association for Black Journalists, National Association for Hispanic Journalists, and the similar group for Native American journalists, where we hashed out issues and what we both heard, what we all have heard, and how we can continue the conversation. And I would suggest that in whatever field or industry that you're working in, to have similar conversations, brainstorming how you can support or amplify each other.
Just to echo what Ann and Linda said, intervene if you can, report, because that helps us document what's happening, donate if you want. And one thing I really recommend is actually allies could really help Asian American groups, whatever organization you're in, whatever workplace, is actually have official statements announcing the racism and supporting the Asian American community. And we're working with the California Superintendent of Schools to do so. And these official statements are helpful for two reasons. First of all, Asian Americans, it helps us feel seen and heard if there is an official statement acknowledging our pain, acknowledging the racism, acknowledging that others are supporting us. And secondly, we found how much words matter, how the president's words last year, his hate speech went viral and led to hate violence and normalized hate. And so what we need are official statements to normalize love and respect. It's sort of obvious, but it's actually really needed to have these official statements to create a corporate culture or a newsroom culture or a campus culture. So I actually think allies could help us by also pushing for these kinds of statements, working with your Asian Americans, friends, coworkers to get those statements out. And then once you get out, then say, oh, well, put your money where your mouth is, and then make for a corporation you're working in, follow up with donations and ongoing support.
Yeah, thank you, Russell. I also want to mention that, in Oakland, when I talked to Carl Chan, he's the president of the Chinatown Chamber of Commerce, and he mentioned that for many, many years, long before the pandemic, Asian organizations have started connecting with African American organizations and working together on different social issues campaigns. So wherever you may be based, seek out these already existing partnerships, and you can highlight them, learn from them, or join them.
So I'm looking at the questions here. We have one that says, how do you talk about interracial violence and hate toward Asians and the collective power of collaborating with the Black Lives Matter movement? Anybody want to take that one?
I think we need,
Oh, Russell.
yeah, this is a really difficult issue because I think we have to acknowledge there's anti-Blackness in the Asian American community, and I presume there's anti-Asianness in the African American community. So we do have to deal with our own interracial issues without making the focus interracial conflict and not acknowledging overarching is white supremacy that seeks to divide and conquer groups, white supremacy that subjugates groups in different ways and racializes us differently. So I always point out that Stop API Hate is working in partnership with Black Lives, even though there are different racial issues, different types of racialization. As we try to dismantle that perpetual foreigner stereotype, and Black Lives Matter addresses, mass incarceration or policing, I think we're both working together to dismantle white supremacy overall. And so how solidarity work looks like may vary. If I'm spending all my time addressing anti-Asian hate, I don't have that much time to show up, right? I could barely show up for any anti-Asian hate stuff and to always have to show up for other things. So I think for me, solidarity means, again, really caring and hurting and supporting when you also extending grace when you can't always show up, but you know that you trust that are working together, overarching goal towards racial justice.
Sorry. We have a question from Ruben Tapia from Radio Bilingüe, who says he's looking for Spanish-speaking sources to talk about this issue, and maybe that's just something offline or something, unless something comes immediately to mind. So just wanted to raise that question, and then we had a question from somebody asking about whether there's been an examination about whether there is a difference in incidence based on the class of the communities. Are there more incidents in wealthier communities or more incidents in working class communities? I don't know if you have any sense of that.
Earlier in the pandemic, there seemed to be more incidents in the Bay Area. And I talked to some grassroots activists about why that is. And one of them had a really interesting theory that because Northern California is more dependent and uses public transportation on a higher percentage, the likelihood of different communities and different cultures interacting with one another is greater versus Southern California, which is very steeped in the car culture. And I thought that was an excellent theory.
Yeah, I agree with I think there are class differences. I think there's two related trends. First of all, we have the race fomented by the political rhetoric, and Asians have long experienced violence if you live in a multiracial, low-income neighborhood, right? Because those are high crime neighborhoods, and we've always faced that type of crime. And now they're getting conflated, right? That everything becomes a hate crime. So we have to keep them distinct. And I guess from my observation, yeah, there's a lot of violence in high crime neighborhoods, obviously. And, but I think what Anna was talking about, urban dense communities have more occurrences because there's more possibility for interaction and violence.
We have a question from Anne-Marie Cunningham about whether the mental health strains in the AAPI communities have resulted in more domestic violence.
I do not have that data specifically for domestic violence, and domestic violence in AAPI community is a complicated topic because a lot of underreporting happens there, whether it's due to language, culture, or like immigration status. When I worked in domestic violence resource center for AAPI, a lot of them waited until things got really bad because they were afraid they were taken away. The victims thought they would be kicked out of their country if they get in any legal trouble. So I do not have the current data, but I do hear from my clients that there's a lot of family conflict rising more because everybody's been home. Everybody is interacting more. So I think that's what I can say.
We have another question from Anna Almendrala saying, for Professor Jung, what do you say to critics of your Asian hate incidents crimes database who say we can't measure the rise of something we weren't seriously tracking in the first place?
I agree. We're not saying there is a rise from the previous year. We are saying, though, there is a surge. It's sort of evident because people weren't spitting and coughing on people, as far as we know, in 2019. So for us, it's sort of the anecdotal. We have hundreds of cases of people spitting and coughing now, and that wasn't very common in 2019. But yeah, but there is no baseline, right? There is no baseline for pandemic-related discrimination. I agree.
And I know that we're reaching the end of our time here, so I did want to just ask all of our panelists if there's any story ideas you want to share as we close here.
I think there's huge potential for more coverage among the younger set. You know, kids are going back to school now, and the potential for bullying, stereotyping, violence is exponential. And we have not been in the classrooms with the kids. And if there are any districts that would allow that, I think that would be a great view.
Yeah, just adding on to onset, parents in our therapy spaces are expressing a lot of fear around that, sending their kids back to school. How would that look like? Will they be bullied? So that is a real concern that is being brought up a lot. And people just in generally going back to public, and then there will be more interactions and all.
Yeah, I think those are great ideas, especially the return to school. Again, Asian Americans are the racial group least likely to send their students back to the classroom. I would like to see stories of how Asian Americans are resisting the racism. And again, how they both deal with and how do they respond. One great story is, like, we talk about the grandma who fought back, but there's one case, Midland, Texas case, where the person got slashed. That's really forgiving. And that's a really great model for restorative justice. He says people shouldn't be racist. He denounces that type of racism, but he's been able to forgive his perpetrator. And I think that's the kind of story we need of restorative justice that will break the cycle of violence. I really appreciate his story.
Well, that seems like a fitting close to this conversation. I want to thank all three of our panelists for their insights and for the audience for their great questions. And we're going to be making available the recording of this webinar, as well as the PowerPoints that you saw a little later today on centerforhealthjournalism.org. We're also going to be sharing a quick survey, and we encourage all of you to provide your feedback on this program. So I want to thank all of you and wish everybody good health and a good day.
Thank you. And Ruben, reach out to me. I have some ideas for you for Spanish speaking sources.